So this is a short video that you students have been asking on the destructive procedures. So when I'm talking about the destructive procedures, we have got three things: evisceration, enucleation, and exenteration. Okay. Now what are the differences between them? Evisceration means removing of the viscera. So we are scooping out the contents of the eyeball with the help of the evisceration scoop. Like we have a ice cream scoop, like we have a Calazion scoop, similarly we have a evisceration scoop. So you are removing the contents with the help of this evisceration scoop, and what you are doing, you are putting a artificial prosthesis inside this empty eyeball, and you are putting the corneal or the scleral button back. Okay, so that is actually evisceration, where you are just emptying the contents of the eyeball. Now what are the indications of this evisceration? Number one, expulsive choroidal hemorrhage. Number two, we have got the panophthalmitis. And number three, bleeding anterior staphyloma. These are the three important indications. Now, second is enucleation. In evisceration, sclera was left intact, but in enucleation, we are removing whole of the eyeball along with a part of optic nerve also. So this is actually done in cases of the malignancies. Okay, whenever we have the intraocular tumors, we always do enucleation. Then in absolute glaucoma, we do enucleation. In sympathetic ophthalmitis also, we do enucleation. In panophthalmitis, one should never do enucleation because there is actually a chance, there is a risk of infection going to the other side. And finally, we come to the exenteration. Exenteration means you are debulking the orbital cavity. So when we are removing the contents of the orbital cavity, the eyeball, the adipose tissue, everything, that is actually the exenteration, and that will be done in cases of the orbital tumors. So I hope you get a clear insight what is evisceration, enucleation, and what is exenteration, and what are their indications and contraindications. Stay tuned. Happy ophthalmology.